Wonderful. Well, thank you for taking your time out of your day. I hope to make this extremely worthwhile for you to give you some thoughts and some insights from my perspective. Um, we all know the numbers in venture capital, how dismal they can be. 1 in 10 is really the number that we say that you're going to have a success in venture capital and in startups. One of the things that I've done in my career over the last 20 years is really looked at this from a first-person perspective, in being involved with these companies and these startups and seeing exactly what they're doing right, what they're doing wrong. And so I hope to share some of that information in a new way with you today. Um, and there's two things I'm extremely passionate about. Number one, I'm passionate about the future of healthcare and the future of technologies and where things are going. And I'm extremely passionate about not wasting the dollars that are out there. And we see so much money being wasted on technologies that don't go anywhere. Um, I think one of the latest one that comes to mind is Forward Health. If you guys know that one, about a year ago, I think it was December or November of 2023, they raised $100 million. And immediately that day, I sent a post out and said, "Hey, Forward Health, this is a really impressive company. They raised $100 million, but they're going in the exactly wrong direction." And I stated that publicly on LinkedIn. And then this last December or November, they ended up going bankrupt. And so I hate to do this, but I sent out another message that said, "Hey, I could have saved the industry $100 million if somebody would have just listened." And the elements of the customer alignment to the product that they developed was wrong, and that was easy to see from the beginning. And as you start to shape your lens around this element of what the customer's needs are, and align that to the product that you're developing, then we can all develop products that are going to help healthcare and going to be a better investment opportunity down the road. Um, so that's kind of my intro, but Rick said that this was a first part of 3 series of commercialization strategy presentations. My other two partners, Steve and Nat, are going to be talking about it and carry on from the innovation side of the perspective to commercialization. Excuse me. So on April 2nd, Steve's going to be talking about innovation to impact, taking that innovation that you have and then putting in these commercialization strategies and techniques in today's market, which has changed drastically over the last 10 years. And then Nat is a guru in communications and marketing. And so she's going to come in and talk about those communications that you can use to be able to help you gain that adoption as well. And so look for those down the road. And I know MTech and the team will be promoting those. And so we look forward to bringing that to you as a three-part series. I want to start with this. I told you one of my passions is not wasting money, right? In 2024, $274 billion from venture funding was raised. And that's a staggering number when you think about it. And that's over all venture funding. But the key thing to understand here is that that's the dollars that you're going to be competing for if you're fundraising and if you need venture dollars to move you forward. Digital health is a very, very small portion of this, 5.7%, about 15 million, I believe it is. And AI took home 37% of venture funding in 2024, which is an amazingly large category within venture funding. And I bring this up for a couple of reasons. I bring this up because I think the entire pie of dollars and where their mind is at, their biases, is important for us to understand as entrepreneurs as we're raising new innovative companies that are going to need to tap into these dollars. But I also bring this up because I started to ask questions. I started to say, okay, what's going on in the venture industry today? Venture funding is more difficult to raise than ever before. Part of that is it's being pushed towards AI, but part of that is they're getting smarter and smarter and smarter in their diligence, which they absolutely should. And that's because historically, it's been all over the map. So I want to show you some statistics here. Number one, Venture capital has the widest range of returns compared to all other investment opportunities. This means that there's a lot of people, not a lot, some people that are doing really, really well in venture capital, but then there's some people, and probably a decent amount of people, and I'll get into what I think the numbers are, that are not doing well at all. And so there's this huge variability, right, in how venture firms approach investing into companies and technologies and the success that they have. Couple more data points for you. The dispersion of returns varies greatly. So the dispersion from the median of what is normally being returned versus what other funds are returning, you have, again, this wide variability in venture capital versus other asset classes. The difference between good performing funds and bad performing funds is extreme. So the median fund return is pretty decent. This shows us, between 8 and 10%, which is okay, right? But that's across the entire industry of venture capital. And you look at the dispersion measures of the difference between the 25th percentile of earnings and the 75th percentile of fund returns. Venture capital is off the charts. That's highest in terms of that variability that exists. So clearly, there are some funds that are getting it right and some funds that are not getting it right. And in fact, this graph shows us that about 10%, a very small portion of venture capital funds, are the winners in this innovation casino. Everybody else is missing the mark, right? And this is historically. I mean, this one's specifically from a 2019 presentation, but I think it only captures some of the earlier funds. But it hasn't changed. It hasn't changed from data that we've seen up until 2020, 2023, when venture firms started to pull back on the funding that they are going to deploy to companies. And so to give you one more graph, and then we'll get out of this venture numbers from you. But in fact, 1 in 20, 5% generate expected venture capital returns of more than 3x for their fund. Half of all funds actually lose money. They return less than 1x of their investment into companies that they make. This is a staggering number. And so there's a few groups that are getting it right. And then there's a lot of groups that are getting it wrong. And the getting it right and getting it wrong has to do with very, very specific concept that this entire presentation, I believe, is about. And it has to do with cognitive bias. And cognitive bias is something that is stuck in all of us. It's been stuck in venture capital world, and so many of these funds are not stepping out of their cognitive bias and using the objective data they need to be able to place these investments accurately. And so many of us as entrepreneurs don't step out of it. And this cognitive bias is what makes us have wrong strategic decisions, wrong strategic directions, bad product choices, and ultimately puts us on the wrong path towards failure. And so the first step is to understand this, that everybody has it. It exists with the investors, it exists with the entrepreneurs. And so we got to figure out a way to get around it and push through it. But there's an element here that I think is critically important. And it is something that I will continue to pound my fist on and say, which is that every startup that fails does so for one reason. And every startup that is successful does so for one reason. And that one reason is customers. If you're able to gain customers, then you're going to be successful. If you are not able to attract customers, then you're not going to be successful. And so your entire success lands with whether or not you can align to what those customer needs are. In fact, CB Insights backs me up. They're one of the largest tech research groups in this space. And they say that the top 20 reasons that companies fail, the number one reason by a large majority is no market need. And that no market need is tough to figure out. But that is the critical important element. All these companies moving forward, getting funding, painting a picture of a strategy and a product that is going to be successful in the market, then getting to market and realizing there's no market need and failing is funding that should have been saved. And we can do better. In the past, maybe you had to take this risk and go out there and do an MVP and test it. Today, we can test so many things early. It's too expensive to get to market and realize you went in the wrong direction. We can do it much sooner today. And we're going to talk about this in a little bit more detail. But this is why I believe that market validation is the number one most contributing factor towards building a successful medtech company. This market validation early on, iterative and objectively, is what companies today, investors today, have to be able to do and have to be able to understand. I was listening to a presentation by Adam Dakin, who's a former venture investor, and he said this very eloquently. I love an algorithm for us to be able to understand that, how to accomplish things. And he said one of the main reasons for not reaching customer adoption is that they don't make it on the short list of problems that decision makers with budget authority are willing to pay for. Take a picture of that, write that down, internalize that however you can. I'll say it one more time. They don't make it on the short list of problems that decision makers with budget authority are willing to pay for. So that's what you need to achieve as an executive in building a new technology innovation, a company moving forward, or investing in a new technology, is you need to make it on that short list of problems that decision makers with budget authority are willing to pay for. And so you do that by helping them solve a specific problem. I like this animation, this graphic. I don't know who it's attributed to. I've seen it for decades now, and I've used it a lot. But I think it's really interesting because we see this all too often. This is describing a swing, right? And we see that this is how the customer explained it. It has these 3 tiers. And then the project leader gets it and they interpret it a little bit differently and it starts to change shape. Then the analyst designs it and it's something that may or may not work, but it changes shape again. The programmer writes it and it starts to look different. And still, the business consultant comes in and just describes it euphorically for sales and marketing purposes and thinks everybody's going to love it. The project is largely undocumented. Operations installs something incorrectly. The customers gets billed exorbitantly amounts, like they were some sort of amusement park. And then it's largely not supported and cut off because customers didn't want it. When in the end, what the customer really needed was just this simple tire swing. And I love this. It's just a fun graphic to describe and chuckle at and say, yeah, this happens too much, right? And what we really need to understand is how important these customer needs are. And I love how Stan Rowe, a former CSO of Edwards Life Sciences, stated it. He said that projects don't fail because the technology doesn't work. They fail because we didn't understand the customer requirements, didn't understand the distribution, didn't understand the competition, didn't understand the payers and referral patterns, all those extrinsic factors. If you don't have early stage marketing integrated into your teams, you're flying blind. And so this is a mindset shift of, not developing the technology at all costs, but understanding the customer at all costs in an objective fashion so we can move forward in the right direction and the right strategy. One of my favorite business mentors and minds that I've looked at over the last 20 years in my career, it was Clayton Christensen, who is known for Innovator's Dilemma, Innovator's Solution, and a lot of innovation writings and books in business in how companies can be successful in it. And one of the theories he talks about a lot is called jobs theory. And this is simply stated that people don't want to buy a 1/4-inch drill, they want a 1/4-inch hole. This is the mindset element that we need to shape and change in the way that we build companies moving forward so that we can be more efficient. And he's pounded on this for decades now, but somehow we keep forgetting it. The customers, people, and companies have jobs that arise regularly and need to get done. And when customers become aware of a job they need to get done in their lives, they look around for a product or service that they can hire to get the job done. This is simply what happens when a product gets purchased, right? And so understanding that nuance of what happens and why they're choosing this helps shape how you address your strategies, your research, your product development, your company development moving forward. And it's critically important. He goes on to teach that when we buy a product, we essentially hire it to help us do a job. And if it does the job well, the next time we're confronted with the same job, we tend to hire that product again. And if it does a crummy job, we fire it and look for an alternative. The circumstances are more important than customer characteristics, product attributes, new technologies, or trends. And this is true for any product that gets hired, any product that gets purchased, whether that be at the hospital level, with physicians, with consumers. They're hiring it to do a job. So understanding that element and building that into your product strategy in the beginning is critically important. And this takes kind of a new style of marketing. Our traditional sustaining innovation is this element of upstream marketing, where we're defining kind of how a customer wants a product to behave and perform. Downstream marketing, we're communicating that value proposition back to the customer. But disruptive innovation requires something a little bit different, and that's discovery marketing. This discovery marketing is where you go and search and find and understand things about the customer that even they don't even understand, and understand that in a way that the competitors don't understand it, so that you can build a product that meets their job to be done better than anyone else. And that's where disruptive innovation can be successful, is when you can firsthand see that and discover that, and then align your product to that in a very objective way. So easy to say, people can't tell you what they need, you must discover it. So you can't go out to them and say, hey, what do you want to do your job better? That doesn't work. You have to go discover it with them and understand these elements of, okay, what are they actually trying to accomplish here? How well is the competitor accomplishing that for them today? What is not getting accomplished? What elements can we bring together? There's so many different ways to look at this, but understanding they have a job to be done and you have to discover it is your primary objective. Steve Blank writes a lot about this, and he states that a startup is a temporary organization designed to search for a repeatable and scalable business model. That's the startups of our world, is to search for this repeatable business model. As you find that, then you're able to align that those needs, the customer needs, to your product and your value proposition. And when those align, that's when you have customers buying your product and you have a successful company. Now, the customers in healthcare and medtech and health tech, digital health, all of these elements have a lot of stakeholders that we need to satisfy. This value ring has to be able to touch and hit all the stakeholders that are involved. And your product might have one or two of these. It might have multiples of these, might have all of these. But understanding that you have multiple stakeholders that you need to align to, they have specific jobs that they need to have done. And your value proposition has to speak to all of that. It's a tall order, but it's definitely doable, and definitely less risky when you do it specifically and methodically from the beginning. So lots of questions to answer here, but let me propose seven specific questions that we have found critically important to ask yourself to build an objective value-centric strategy. And this goes for any new innovation that you are trying to determine the direction for or where it should go. These are the 7 questions that we would recommend. Number one, who are the key stakeholders I need to satisfy within this group here? Who are the key stakeholders that you need to satisfy? What unmet needs or problems do they have? What is their job to be done? Number three, what is the current standard of care? What options do they have and are using today that is satisfying that job today? And then figuring out number four, how does my product change the trajectory of the standard of care, whether that be in clinical results, whether that be in pricing, whether that be in utility or utilization? How do you change that, right? How do you get them to go from away from that? In healthcare, that's really hard to do with all the guidelines and everything that physicians have to follow. Number five, what is the quantitative economic value of my product? The value analysis committee will have a say in your product. And so what is that quantitative economic value is what you need to extrinsically state to your customer eventually and prove within clinical data or whatever it might be to have in your materials. Number six, how will my product be integrated into existing workflows? Is one that we see a lot of customers miss. And number seven, how will I measure and demonstrate this value? So those are 7 questions to keep in mind to help you look through the elements of all these various stakeholders that you need to satisfy, the questions and needs that they have, and how you might be able to have this objective information to satisfy for them. As you start to answer these questions and do so early, your innovation, I can guarantee you, will take a new trajectory. I hardly ever work at pretty much every product that I've worked with. I forget the last count, over 50 products at this point that have all been pre-commercialization. Every single one I worked through as we walk through a specific process in understanding the market needs, the market dynamics, what's occurring today, what the jobs to be done are, have changed course based on that information and have been successful based on that information. So I know that it's critically important. Um, we tend to, as a company and as executives, think about accessing customers as kind of a simple pillar approach here, where you have your product at the bottom, maybe you have some clinical data, you have some great features, benefits, value proposition you want to talk about, right? You say, okay, well, we got to get FDA clearance. So you go get regulatory clearance. We have to have some sort of reimbursement. Hopefully you're thinking about that. So you go and understand the reimbursement landscape a little bit. You have to have distribution, and then we get to customers. And this is kind of the pillars that we think that we have to walk through. But really what it does is it lands something like this, where those elements only get us part of the way there, and the whole thing tips over and is not successful without a very important element, and that's the value proposition. That value proposition is where those needs align to what your product delivers, and that's what makes all of this market access successful. Stated clearly, the benefits you promise, or value proposition is the benefits that you promise a customer should they choose to buy your product. And so this is the most important element within designing a product moving forward that's going to be innovative and innate in nature and competing with the solutions that the customers are using today. Why value matters? Well, it matters more than ever before, particularly in healthcare. This healthcare continuum is placing emphasis on quantifiable value more than ever before. And AdvaMed stated it this way, and I like it because it's very clear. It says it is a business imperative for medical technology developers to understand, demonstrate, and clearly articulate how their offerings can not only improve patient outcomes, but also create value for each of the key stakeholders across the healthcare delivery continuum. It's imperative. It's absolutely critical that you understand this. And the earlier you start this, the sooner it starts to shape your strategy, your product moving forward, so that when you actually bring this to market, it aligns easily with the customer. I propose you take an approach similar to engineers. As Rick mentioned, I'm a biomedical engineer by education, and so I have this built into my mindset. And this is what we teach and coach and work with our clients to be successful in saying, okay, you have this big picture, you have this vision, right? The market is in a stance in some way, shape, or form today, performing, having competitors, having solutions, price points, elements. Your job is to break that down to the core principles. What is going on here? Why are they buying this product versus that product? What do they actually need, right? Where do they have two products that they're using instead of one? What do they actually need to accomplish? Where are the clinical results falling apart? All these elements start to shape how then you can engineer these strategic pathways. So breaking it down and understanding objectively this data and information to then pull it into your strategic pathway is what's critically important. And what we have found, and I've done this for dozens and dozens of companies and with dozens and dozens of companies, even within my own investments and incubation of companies that have been successful as well. And these 8 points are what I found to be this this framework that works well in understanding the customer needs and understanding the dynamics of the strategy that you need to build and engineer for your company and for your product moving forward. The first section has to do with secondary research. This has to do with first understanding the healthcare need. We look at a lot of peer review articles, analyst reports, databases, health economics to start to shape exactly from the public's perspective, what does this need? What have they seen the need is? Where are the opportunities, right? And so this is from data that exists there today. The second, critically important, competitor positions. This is competitors addressing similar or competing healthcare needs are outlined and organized to show their position within the market, how they're aligning to the need that you believe exists or that you could do better on, the gaps that they have, the opportunities that exist that competitors are not addressing, and why that is true. The competitors is one of the ones I love the most because you get to understand where they think the needs are and jobs to be done are within the market. And then you're going to go discover how well they're actually doing that in a much more methodical way to be able to win. But every market has a competitor, and just think of that in terms of the where that customer is turning for a solution today. In one of the clients that we worked with closely, the biggest competitor was the patient choosing to do nothing. And we wrote that clearly into the strategy from the beginning, and it truly shaped things. And so understanding those competitors is really critically important. Reimbursement realities. We cannot ignore reimbursement. So understanding the reimbursement starts to shape things. If you have a $500 product and reimbursement is at 400 and there's no way of changing that, then you need to build a $400 product. And so understanding those realities starts to be really important. Market size. How big is the risk relative to the potential reward? And this is a balance between secondary research, where you have a lot of numbers out there that you can start to have and you take with a grain of salt. But then you also have a lot of numbers that you need to go find on your own to be able to pare this down and segment this down to the exact market and value that you are going to bring with your product and the opportunity that that represents for your company. The second group of these has to do with primary research. And so this is going out and finding information that doesn't already exist, that you need to be able to understand and discover, that starts to shape your thinking, changes your cognitive bias towards something that is actually going to be successful and what reality is. Customer insights. This is qualitative research and conducting using Health Leaders Network. This is from our language. So wherever you find those key opinion leaders and non-key opinion leaders to understand the elements of their needs and the nuances of their needs to be able to discover something that is going to that you can align to better. Customer analytics is the quantitative research element of this, and I'll go into both of those a little bit further later on. Then the market forecast, so you can understand exactly how your product is going to fit within this entire landscape and fit within the specific needs that your customers have, who those customers are, the segment that they represent, and what that value could be for the company. And then finally, strategic acuity, which is taking the intelligence and insights that from your experience that you've learned in all this data and putting that into a stepwise approach for the company moving forward. And so these 8 points I've seen happen over and over again, refined them over and over again. And it's not just a simple process of stepping through them. It's stepping through them, iterating, stepping through them again, but understanding that all this information helps you engineer and build those strategies you need to build moving forward. Um, so just to kind of expand this out a little bit further, again, to say that secondary research is you going to understand that public perspective of the market, whereas primary research is you taking what the public and competitors don't know about the market, and that is a critical, important element for you to understand. The qualitative interviews and quantitative surveys, a few points there. I've learned a lot through the years and made a lot of mistakes, but a few elements here for you to consider as you're going through these. Qualitative interviews, your goal is to discover. And so you're not selling, you're not pushing. I have had so many doctors and entrepreneurs come to us and say, I've talked to a dozen people, they all love the idea. Okay, great, but that's not what you're trying to do when you're talking to these people. What you want to do first and foremost is connect with with all relevant stakeholders. So if you need physicians in the equation, interview them. If you need value analysis committee members into the equation, interview them. If you need a government entity or patients into the equation, make sure you connect to all relevant stakeholders. Target at least 5 to 10 interviews from each group initially. And I say initially because you are going to expand that to tens and 20s and 50s and hundreds eventually over the course of this. But what we found is between 5 and 10, you start to see a simple convergence that allows you to move forward in the process, even though you're going to continue those interviews moving forward. Your format should be non-scripted, but organized. So you want to get to know their lens, number one. Number two, understand how they're doing things now. And then number three, ask about what they're trying to accomplish. And so as they start to talk about things that they want to talk about, that's where discovery starts to happen. Number four, objectively describe your value proposition. That's fine. You're not selling anything today, but you're describing methodical element fit, facts, features, benefits of what you think a solution could be, and then allowing them to respond to that and dive deeper into the points that they bring up. I think it's critically important to allow the conversation in this qualitative interviews to go where it needs to. You're not selling. You're allowing this conversation to go where it needs to so that you can start to open your eyes and start to change your cognitive bias towards what's actually occurring in the market and needs to occur so that you can align specifically to that. From a quantitative surveys perspective, the simple format that we like to follow is first screen for the professionals that are closest to the subject matter that you're talking about, understand their demographics, then start to ask them about their current use, their current decisions on products, needs that they have with those products, satisfaction, challenges, decision-making authority, ask questions about that. Then you're going to present your value proposition that you think is going to resonate well. You're presenting this as a hypothesis, right? And then allow them to respond to it. So it's similar to the qualitative in nature, but the quantitative allows you to specifically state things like 97% of physicians said they would switch to a product that had this value proposition versus what they're using today. And that is invaluable with developing strategies and raising funds for new innovations moving forward. So a few points here is, again, broad perspectives. Your goal here is to quantify. You're looking to gain broad perspectives on narrow topics. Target 50 to 100 initially in these surveys and start with concluding statements. This is, okay, I want to be able to state this at the end. That shapes the questions that you ask throughout the process. The value proposition points presented should match identically to the test questions following. And that way you can align the needs that the customer has to the value proposition hypothesis that you had and how that came out to be important or not important for that customer. Every single time we've done this, we have changed the direction of features and benefits and for products and innovations that companies are developing. And this is iterative in nature. So you might need to run it again and again as you start to narrow in that further. One final element here about value proposition that I think is important. Again, hopefully a lot of these thoughts and ideas start to shape your mind and how you're going to approach your strategy to be strategically objective in the future. There's three elements of value proposition to look at: what you do well, what your competitors do well, and then what your target customer really needs. And if you look at the intersections of these, if you look at strictly what you do well and what your competitors do well, it's just a direct comparison, no differentiation, and does not involve the customer specifically. And so really it's who cares? Don't go there. Don't go there. If you look at what your target customer really needs, and then what your competitors do well, and the intersection of those two, well, that's where you're not going to differentiate at all. And so being disruptive in that space is not capable. Being a Me Too product, maybe. And there's a lot of strategies in that, right? But what I'm talking about specifically is being disruptive and being highly innovative in technologies. And so just looking at what the needs are and what the competitors do well is not an area that your value proposition should be painted off of. What you want to be in is what you do well, right? And you might shape that differently based on the research that you do, but then also with what your target customer really needs, and that's where you want to play for your value proposition. So keep those in mind as you're walking through all the research, the secondary research, the primary research, the qualitative interviews, the quantitative surveys. You're looking for, okay, what can we do well, differentiating ourselves from the competitors today that the customers really need. And that's where magic starts to happen. Success happens in startups to make you successful as a company moving forward. The last thing I'll state here, objective evidence is what you need. That's what you need to build a strategy. It's what you need to convince your internal individuals that you're going in the right direction. It's what you need to put together the right clinical strategy, the right product strategy, the right FDA strategy. Objective evidence actually is the specific element you need there. It's what investors need, right? We got away for several decades of investing in venture capital that a lot of those results that I showed earlier were indicative of, in showing that the objective evidence wasn't there. The objective evidence for the example I gave you last year was clearly there, but yet we still invested into it. A lot of venture capital still invested into it. So understand that you're going after objective evidence, and you need to be able to understand that that data is what investors need moving forward more so than ever before. Investors are needing that data. You need it for strategy. That objective evidence is what actually is going to allow you to win. We wrote a book on market validation essentials several years ago that I put the QR code up here. There's the URL if that's easier for you. That walks through everything I talked about today in a lot more detail. It's a workbook fashion, so you can walk through and start to learn how to change that cognitive bias even further. Some concrete examples, concrete processes and questions to help you achieve this even further. And so please, if that's of interest to you, go download that. It's free. In exchange, we ask for your information, obviously, but hopefully that gives you some further insights into how to continue down this path so you can be wildly more successful than your peers and start to change this venture capital landscape so that we can develop the two things that I'm passionate about, right? Which is better products for health and technology and future products, and then also not wasting funds the way we have in the past. And so, thank you for your time, and would love to see if you have any questions or comments.
Thanks, Aaron. That was a great presentation. Invite anybody to come online, on mic and on camera to ask any questions or put them in the chat. And I also put the link in the chat too. If folks don't want to use the QR code, you got a live link going to the to that market validation ebook, which I've read and is excellent. So I
Thank you.
appreciated Aaron sending that to me in the past, and I use it as a bit of my own Bible. But I've got a question for you, Aaron, and it has to do with the value proposition. And I think your slide 24, when you're looking at all the different um, folks involved in the value proposition and the stakeholders. In general, in the past, I've always guided folks to create a value proposition that shows both the efficacy of a product, whether it's saving lives or preventing illness or what have you, and then the health economics piece of it, which means, reduced hospital stays, reduced cost to the hospital. I'm wondering if when you're doing your primary market research, maybe you customize the value proposition, to each different stakeholder, or do you really try to combine and use one solid value prop across the board?
No, absolutely. Customize as much as possible. I mean, what what's going to be important to that the provider and the value analysis committee is going to be different element than what's important to the physician. And so we aim to have 3 to 5, sometimes more, 7 concrete value statements within that value proposition that we're testing, and ideally, you'll have exact numbers in there too. So if you run your health economics, right, and you're going to value analysis committee members and you're saying, hey, if we can bring down your cost by 10%, right, what's your response to that? Versus, if we bring down your cost by 25%, right, or if we can reduce your inpatient days by 2. And you start to get the response directly to some of those numbers that they have. And so absolutely, Rick, I say customize as much as you possibly can for the stakeholder that you're going to.
Yeah, it makes a lot of sense. Yeah, it's interesting because my philosophy has always been one specific value statement for all. But it makes sense, especially when you're doing your primary market research, to be able to customize it according to the proper stakeholder. So very good. Can you give us an idea of how you work with clients? What the business model is and how you maybe begin to interact with them, depending on where they may be in their process here for market validation?
Sure. Yeah. Thank you. So we are traditional consultants, but we work in a couple different ways than traditional consultants do. And so one is we can run projects. So we can run those 8 points, help you find all this objective information, and which a lot of clients like because that's, kind of the definition of objectivity, right? Is you having a third party that's giving you this data information, and investors end up liking that as well. So we can run projects and do that. The other element that we have that we're actually growing more and more in is coming in and being a fractional resource for you and your team, to where we can support you and having this marketing element for whatever budget you do have at the time, to be able to accomplish some of these elements in the beginning moving forward. And so instead of hiring a full-time individual that you only need for like 6 months, you can hire our team fractionally and cover either that early stage work or the commercialization work or the marketing work, or others. And so that's how we engage with clients and work with clients, is on project base and then a fractional base.
Very good. That's becoming a very popular technique, and I'm glad to see that that you all offer that as well. You see it amongst CFOs or fractional CFOs and fractional CEOs, and so now fractional marketing person makes perfect sense to add to the capes of a company. All right, we are near the end. I wanted to just do a final poll question. If you'd like to have Aaron reach out to you, please indicate so, and we will send him your contact information. We generally don't give contact information out during the webinars to respect folks' privacy. So you can either do that or through the QR code or the link in the chat to download his report.
Thank you, everyone, for your time. Thank you for spending a few minutes with us today. And yeah, if there's anything we do to support you or additional information we can give you, please don't hesitate to reach out.
Yeah, and we're very excited about this. As we mentioned, is a webinar series. So the next webinar in this series is it's gonna be a little bit of a time gap, but we're gonna get there. And I'm trying to move it back up to right where you were before, and April 2nd will be our next webinar with the Innovation to Impact with Steve Sapo, is it, or how do you pronounce his last name? Sappet. Okay,
Yep.
great. And then just for everyone's edification too, next week we're going to have Grant Engine. Oh, there you go. Perfect. Next week, we're going to have Grant Engine talk about non-dilutive funding strategies. So you should receive emails for that. And please join us next week for that webinar. Aaron, thanks very much for your time and inclination to help us out here. And we really appreciate it. And everyone have a great day. Thank you.